VP of Legislative Affairs. This is a CME presentation. If you are eligible for CME, all you need to do at the end of this presentation is to answer one question. Either what did you learn, or what action will you take from what you have learned? Then write the response in the chat. It is my privilege to introduce today's speaker, Mr. Dan Finch. He is no stranger to us. Dan has been with TMA for many years and is the VP of Advocacy at TMA. His strong leadership and that of his team forges the way of our advocacy at the TMA and TMAA. Dan and his team have great relations at the Capitol with all legislators and their staff. They work tirelessly for the family of medicine to protect the interest of our patients and our communities so the physicians can practice the best medicine to their patients. During the session, this team works nonstop. On some days, they literally work around the clock. TMA and TMAA has the best legislative team in the state, if not the nation. We also would like to wish Dan a happy belated birthday. Dan, happy birthday. Thank you. Take it.
Oh my. Again, I hope you recorded that introduction. Martha, that was the kindest introduction I've ever had. And I want to get a recording of that so I can play it back nearly every day during session when I feel beat down. Thank you very much. It's great to be with you all, and it's nice to see so many old friends. I see Linda Adkins out there and Sue Bailey, and this goes back to all my time in Houston as well. In addition, the last 14 years with TMA here in Austin. I will tell you that thanks for joining us. We're getting really used to Zoom, and I'm getting really used to my new commute and the very relaxed dress code around here. I believe it's the first time. I think I've given more presentations for CME wearing a t-shirt and a ball cap this year than well, as you would expect. I'm even getting used to Zooming with members of the legislature dressed very similarly to this, and they don't seem to mind much either. Anyway, let's get started. Sasha, if you'll roll up a couple of slides here. The disclosure, do I have to read this? As far as I'm concerned, let's just move along. This is the TMA commercial. We are the largest state medical society in the nation. We don't have the most doctors in Texas. I believe there's more in New York and California and maybe Illinois. We have the most members, and that's saying something. We have to go recruit our members every year. Over 53,000 physicians, medical students, and residents are members, all specialties, 110 component county medical societies. And in addition to our legislative work, we have a very strong practice management division. And I hope that you all will engage them from time to time as you need their services. Next slide, please. Just to let you know, medicine, in addition to what you all do, is a real economic driver in Texas. The total number of jobs, you can see that the average number of jobs created per physician, 13.1. That's impressive for its number, but I think it also highlights just the administrative aspects of the practice of medicine these days. And your total annual economic effect on the state of Texas dwarfs other parts of our economy. Next slide, please. We are a fast growing state. We continue to add population in the state of Texas. We continue to license. I think last year we licensed nearly 5,000 physicians in the state of Texas, which is, and if you will recall, back in 2000 to 2005, we were pretty flat in licensing, about 2,200 physicians a year. But in 2003, when we passed liability reforms, it took about 3 years, but folks began to notice, and that's when our licensing numbers really began to increase, which is great because we are a fast-growing state and we need every doctor, and it's a good place to practice medicine. Still a lot better than other places. We still have a crying need for primary care physicians, and we continue to rank 47th in the nation in that. Next slide. Just to give you a brief overview, the legislature meets every odd-numbered year. 2021 is that odd year. January 8th is the second Tuesday, and that's when the clock starts running on 140 days. They're constitutionally allotted time frame for a regular session. It is a bicameral legislature. I think the only legislature with one chamber is in Nebraska. But we have a Senate and a House. Lieutenant Governor Dan Patrick runs the Senate as the presiding officer. You see the partisan makeup of the Senate. That is down one from last year, or last session, is one seat did flip. The Texas House likely will be led by a presumptive speaker. He won't get the job until the first day of the session. Dade Phelan, a state representative from Beaumont, Texas. He's lined up the commitments necessary to be Speaker of the House. The partisan makeup of the House is unchanged. There were two seats that did flip. Sarah Davis in Houston lost. Sadly, Sarah, one of the best friends Madison had in the Texas House, and as chair of the Appropriations Subcommittee that handles Medicaid. And that'll be a loss that will be felt this session. The other seat that flipped went Democrat to R, and that was in the Katy area. Gina Kalani lost to Mike Schofield, who regained that seat for the Republican Party. But the partisan makeup changed not one seat. It's still 83-67. And that includes now this session 2 physicians, as we've had 2 physicians retire, John Zerwas and J.D. Sheffield, and the 2 physicians that we have in the Texas House. Tom Oliverson, an anesthesiologist from Houston, and Greg Bonin, a neurosurgeon from Friendswood. Every year, every session, we say the only constitutional requirement is that they pass a balanced budget. We think, well, maybe this is the year they'll actually just do that. And it could well be this, but I suspect there will be more. We've already had 700 or 800 bill filings this week, which is already, bill filing has already started for the session. It's actually at a pace quite a bit ahead of previous sessions. Now, whether they get to as many bills as they have in the past is yet to be determined, because it's going. We don't know how, and they don't know quite how they're going to conduct a full and robust session and still do so in a safe manner. Next slide, please. And so the priorities for medicine change very little from session to session. The details may change, but they all line up pretty much in the areas of the budget, healthcare coverage, insurance issues, scope of practices expansions, and tax issues. Next slide. Talking a little bit about the budget, and I'm pleased that Michelle Romero is here from our lobby team. Michelle is our budget guru and expert, but just very broadly, the total budget for the current fiscal year is in the neighborhood of $250 billion, and that includes federal funds as well. Medicaid is a substantial part of that. In fact, when you lump healthcare spending of all sorts, including the Medicaid budget, what the state pays for employees and retired teachers, healthcare is probably the largest component of the budget. Certainly healthcare and public education make up the 2 biggest spending areas of the state. Our legislature will arrive in January in person, hopefully masked up and socially distanced. And instead of a projected $3 billion budget surplus going into this fiscal year, the comptroller said this past summer that because of the economic effects of the pandemic, that he was forecasting a $4.6 billion deficit going into the session. Now that may change and likely will change. It seems unlikely that it'll be better, but it likely will be worse. So that presents tight budgets. In fact, budget deficits present a degree of difficulty in any legislative session. It's a lot easier when they've got more money to spend, but it is challenging when they have less. We do have a rainy day fund that currently has about $8.8 billion in it. They did hit that last year to support public education increases. And we're hoping that they'll consider using that again this year for healthcare increases, largely due to the increased costs of dealing with COVID that we've seen throughout this year. Next slide, please. Within that budget and within everything else that we want to accomplish, there are things we need to defend, and that's the significant increases that we've made in graduate medical education funding. In fact, in the last session, we saw a 62% increase over the previous 2-year budget cycle. And I will say that as we continue, we are opening 2 new medical schools in the state, University of Houston and Sam Houston State in Huntsville. Now there's talk of yet another medical school formation, and that would be the University of Texas at Tyler. Through all of this, we have said that unless the state makes the investment in graduate medical education, expanding medical school enrollment is not is less a good investment if we do not allow physicians to train in the state. So we have a statutory 1.1 to 1 ratio between first-year residency slots and the number of graduating medical students. We need to maintain that. It is a bad investment on our part if we don't allow folks to, who graduate from our medical schools to train elsewhere, because the chances of them coming back begin to get a little slimmer. It is as true today as it was a generation ago that 80% of the docs in practice start off within 100 miles of where they train. And that makes good sense. It made good sense then, it makes good sense now. Next slide, please. On Medicaid, we have benefit from some additional federal funding this year because of the public health emergency. Texas Medicaid has extended waivers for telemedicine and other services. We did get an increase in our federal match, retroactive to January this year, and it has been really quite helpful. But it doesn't cover the whole spectrum of additional funding that we're going to be looking for in the Medicaid program and in other healthcare programs for the coming year. Next slide. On coverage expansion, and this is the conversation that we've been having since the summer, it has been this. For 10 years, we've talked about a binary choice between expanding Medicaid under Obamacare or nothing. And the political calculus for the last 10 years is that it hasn't been pressing enough for us to actually consider. And so we have really done nothing. Meanwhile, we are surrounded now by states that have all expanded their Medicaid programs with federal dollars, and it's a 9-to-1 match. There are perhaps 31 states that have expanded their Medicaid program. Texas has not. The conversation that we've been having with members, really in order to find that sweet spot somewhere in the middle between full Medicaid expansion under the Affordable Care Act or nothing, has been to talk about it in terms of coverage for the uninsured. At the end of 2019, 18.5% of Texans had no health insurance. They don't qualify for Medicaid, and they can't afford private coverage. And we lead the nation in that percentage. And that was pre-pandemic. And we know that since February of this year, 1.6 to 1.7 million Texans have lost jobs, which means they've lost benefits, which means that they are likely growing that number and percentage of our population that is uninsured. And so the conversations that we have been having with members on both sides of the aisle, urban, rural, Senate, House, Governor, Lieutenant Governor, has been, how can we best utilize our federal dollars? These are our tax dollars that we need to repatriate with the state. How can we best utilize those federal dollars in order to expand meaningful coverage to the working poor of our state, those who are too rich for Medicaid and can't afford private coverage? And honestly, we've been getting a good response. In my mind, even the most conservative members, of the legislature, so long as they don't say, "Oh no, we're not doing that," the conversation can continue. We were on a Zoom call briefly with Governor Abbott not too long ago, and the president of TMA, Dr. Diana Fite, an ER doc from Houston and a longtime friend, asked the governor that very question, and the response she got is that clearly it's something that we need to be thinking about. And I'm fine with that response because it was not no. We are talking with other members, and I think a lot of other members, given the economic fallout related to the pandemic, certainly the healthcare fallout and the high rates of hospitalization and the devastating effects it's having on many communities in our state right now, particularly El Paso. I think that more members are willing to engage in the conversation to find a sweet spot to utilize those federal dollars to provide meaningful coverage to the uninsured. And when I say meaningful, I mean not at Medicaid rates. And we've been upfront with members when we've had this conversation. We have written a letter formally to the governor, and it has been signed by 32 other organizations, including medical specialty societies and those who really want to engage, other organizations that are supportive of engaging in this conversation. This will not be just TMA. It will be a lot of folks. Next slide, please. And you can see here just the graphic representation of the insured and the uninsured. Back in 2009, prior to the passage of the Affordable Care Act, nearly 1 in 4 Texans was uninsured. And we remember how high those rates were. It went down in the early parts of the decade after the passage of the ACA, but in the last number of years, it started to go back up again. Currently at 18.4 at the end of 2019, and probably quite a bit bigger than that right now. Next, please. And so, again, it's a multifaceted strategy, but it also includes some leftover and unfinished business from last year. And that is number one in the Medicaid program, extending coverage for women who are postpartum from 60 days to a year, and extending for kids in the Medicaid program 12 months of continuous coverage, rather than having them reapply every month or 2 or 3. And then falling through the cracks, and then having to go through the hassle of getting back on the program when they get sick. These moves, frankly, don't add much to the Medicaid budget, and it would help quite a number of folks in the state of Texas. Next slide. Insurance reform, always a premier part of our agenda. This year, we're going after some of the prior authorization hassles that physicians face, and you can see a number of the items that we're going to have filed, and that would include having TDI give the specific charge to audit plans for their prior auth processes. A gold card program. If a physician is getting a prior authorization approval at a very high rate for a drug or procedure, that physician ought not to be have to jump through the prior auth hoops every time. Plans know who the outliers are, and they also know when the service is outlining it. Anyway, Gold Card would put an end to an awful lot of administrative hassle. Specifically going after retroactive denials, I still find it hard to believe that if you get an authorization to provide a service, that the plan still has the ability to say, oh, we're not going to pay for that. Telemedicine, as you know, has been something that we worked on for the last couple of sessions in the legislature. Number one, for the first time in 2017, we defined it. And while we've been unable to approach payment parity, we certainly have had coverage parity issues over the last couple of years. But starting this year with the pandemic, telemedicine, I think, has advanced 10 years in the last 5.5 or 6 months. And clearly the governor and the TDI, having waived insurance requirements to require basically payment for telemedicine services at the in-person rate, has been extraordinarily helpful for patients all around the state and for physician practices that have been dealing with dramatically lower volumes of care. We had a teletown hall meeting with physicians on COVID back, I think it was early April, and it was right in the middle of the 2-month lockdown and the 2-month cancellation of elective surgeries. Had 5,000 physicians on the line, asked the question, are you moving into the telemedicine sphere? 75% of the doctors on the line said yes, they were. And so it has become another tool in the physician toolbox to take care of patients. And so in 2017, when we defined it, we basically said that a covered service provided to an enrolled patient by a contracted physician should be paid for. Legislation did not say at what rate, though, but that it should be paid for. In 2019, seeing that many of the plans contract telemedicine benefits out to a national telemedicine company, we added our platform language. And so now that sentence is a covered service provided to an enrolled patient by a contracted physician on the platform of the physician's choice in order to bring that service into the practice as a means of taking care of patients should be paid for. And as we've seen through the pandemic and payment levels, our goal now is simply this: a covered service provided to an enrolled patient by a contracted physician should be paid for at the contracted rate, period. The choice of delivering that service in person or via telemedicine should be the choice of the physician and the patient, because we already have defined telemedicine in 2017 as number one, the practice of medicine, and number two, as complying with all accepted standards of care, the same as in-person care. It's not higher, nor is it lower. So that is another tool for physicians to use in their practice to take care of their patients. And we know high utilization among physicians and patients, high satisfaction rates among patients, and we need to continue this. This issue, though, is not just a state issue. It's also an issue to be dealt with in Congress because over 80% of our commercial market is provided under federal ERISA laws, the Employer Retirement Income Security Act of 1974. I don't know how that sticks with me. Next slide. And here's some of the data that we've collected from our surveys on prior authorization that sort of buttress the approach that we're taking in terms of documenting the delays, the interference, and the fact that patients have abandoned treatment because of the hassle. And it has affected healthcare, medical care delivery with sometimes significant outcomes. Next slide. And sort of a profile, this is kind of a stinger here. 31 is the average number of prior auths completed by physicians every week. Oh my goodness, what is that, 5, 6 a day? And the vast majority reporting care delays, and 3/4 saying it can lead to the patients abandoning treatment. Now, all of this having a negative impact on one, the delivery of care, and two, the expected outcomes that we would be looking for patient care. So we'll hopefully be trying to address that. Next slide. Public health, this whole pandemic has sort of ripped the scab off the deficiencies in our public health system and the inadequate and how we have starved it down over the last number of years. It certainly needs to be rebuilt, and we'll see a good bit of COVID-related public health legislation in the next session. There are a number of things that we need to do. Number one is in changing as we get a vaccine for COVID, as that starts coming online, we will want to change the nature of our vaccine registry, the MTRAC, to make it an opt-out system rather than an opt-in, and that will save a tremendous amount of administrative overhead. 95% of the people who get immunized opt in for MTRAC, but we ought to be expending the bulk of that time on improving MTRAC, improving the interoperability of MTRAC. And if only 5% are going to choose to opt out of it, then let's not focus on the 95%. Let's focus on the 5%. In terms of essential public health services, we've seen the problems related to inadequate technology and interoperability between local health departments in the state in terms of data reporting. And we know how serious data reporting lags can be as you're trying to deal with a fast-moving virus and a fast-mutating virus. So we would certainly be looking to shore up the state's data collection and analysis and cooperative efforts between the state and local county health departments. Next slide. Scope of practice is a perennial or every 2-year concern. I can set my watch by it. I don't know about you all, but everybody wants to do what doctors do, physicians do, without having done what they've done, which is go to medical school. And so we know that the advanced practice nurses will be back seeking independent prescribing. There are literally, and I expect dozens more bills to do this for other groups. Pharmacists, in addition to during the public health emergency, now being able to provide childhood immunizations to kids down to 3 during this pandemic, will seek to have that encoded in statute so they get to do it all the time. And I know that this drives the pediatricians and the family doctors nuts, and rightfully so. I don't know that pharmacists are necessarily held to the same standard of being able to deal with a child who has an adverse reaction right there in front of you when you're giving the vaccine. It doesn't happen often, but when it happens, it can be pretty dangerous. But they will resurrect, in all likelihood, a proposal they had several years ago to allow pharmacists to diagnose and treat a number of, quote, minor conditions, and including going down, I guess, to the pharmacist, having my blood pressure check and diagnosing me with hypertension and providing me a starter dose of medications to lower it or deal with my high cholesterol or what have you. Again, the chiropractors will be back to add neuro to their definition of musculoskeletal, which is kind of worrisome in terms of them declaring themselves to be neurologists. Nurse anesthetists will seek to practice without any physician supervision at all. And I know that in other states, I don't know about in Texas, but it wouldn't surprise me if they did, that they have sought to change their title as a nurse anesthesiologist, which further clouds and confuses the difference between a CRNA and a full board certified anesthesiologist. When it comes to nurse practitioners, our guiding principle remains what it always has been, and that is that independent diagnosis and prescribing is the practice of medicine. Physicians can delegate, but must supervise, because ultimately physicians are accountable for that delegated act. We're more than happy to entertain changes that make collaboration, patient care, and quality and improved communication. But that is our line in the sand is on independent diagnosing and prescribing. And next slide, please. Opioids. I'm not expecting, although I'm not expecting major legislation, but it certainly wouldn't surprise us. We've dealt with the opioid issue over the last number of sessions. Starting in 2017 with the requirement of mandating a check of the prescription monitoring program. It was initially talked about as pertaining to all controlled substances. By the end of 2017, we had narrowed that down to 4 drug classes: opioids, benzodiazepines, barbiturates, and carisoprodol, SOMA. And someone asked me, why is SOMA on that list? That's a Schedule 4. And I said, well, it's part of the East Texas cocktail, which is a hydrocodone to bring you up, a Xanax to bring you down, and a SOMA to smooth out the ride. And then everybody says, well, how do you know that? And I assured him it's not by personal experience, but I've been dealing with diversion issues for the last 10 years in the legislature. Nevertheless, we put off the deadline and the mandate to check the prescription monitoring program until limited it to those 4 classes and put it off until September of 2019 to give us another session to work on it. And in 2019, we went back and delayed the mandate from September of 19 to March of this year, so that we could continue to work with the Board of Pharmacy, the state's vendor, Appriss Health, and the various EMR companies that provide electronic medical record systems to get their software up to speed, so that accessing the PMP and to check a patient record for controlled substance history is one-click affair from inside the electronic medical record. And we already know that 85% of the doctors are telling us they were using an electronic medical record. And we know who the major vendors are. And honestly, I think that we've done, the vendor and the EMR providers themselves have done a really good job of rolling this mandate out in a predominantly electronic integrated environment, as opposed to manually having to look this up all the time for every patient, for every on every instance, which was a complete imposition and a time waste in many respects. We will continue to work with those parties to make it even better. We have a very strong advisory group with 5 physicians on it actually, and led by a pain management physician with extensive knowledge and understanding of the PMP. And I think this advisory committee is widely regarded by the vendor, who's in 44 other states, as probably the most effective and functional advisory committee of any in the nation. There is a requirement that was passed last year to electronically prescribe controlled substances, January of 2021. This coincided at the time of passage with a requirement that Medicare, CMS had for the Medicare program. So we aligned them. CMS may delay their requirement, but the state will not delay theirs. Part of the process of the legislation that we passed in last year, which was a bill carried by Dr. John Zurawas, who is no longer a member of the legislature, but it recognizes that that there are instances where a paper prescription is still advisable for the patient, and it also recognizes that physicians can request a waiver from complying with it for either financial or technical hardship. We've been trying to encourage the board and push the board to getting that waiver process underway. I mean, here we are, the middle of November, and January of 2021 is coming up on us. The board has just last week published rules, and we're hopeful that which mirror the statute when it comes to the waiver and waiver request process. We're simply now waiting for the Texas Medical Board to define and design the form on which that waiver request will be made. And so for all of you who would be thinking about doing that, please do watch the daily bulletins that TMA sends out, Texas Medicine Today, because we'll cover that really extensively. Next slide, please. Taxes are always a huge issue. One issue that we've identified this year has to do with the comptroller's reevaluation of certain tax provisions related to the practice of insurance or not. And he determined earlier this year that they were going to start applying the sales tax to medical billing services, which is they've never done. And so this is a complete reversal of a previous interpretation. There is an exemption for sales tax for the practice of medicine. And one of the parts of the practice of medicine is actually completing and filing the claim form. The practice of insurance, which is not regulated by that, but is regulated by insurance statute, is the processing of the claim. And so we think that the negative aspects of this are going to fall primarily on small practices and medium-sized practices, and not the large practices that do claims processing in-house. And so, in fact, we had a conversation yesterday with the state senator trying to talk him into being the sponsor of this thing in the coming session. And it is not just physicians, it is dentists, it is podiatrists, it is chiropractors, it is a bunch of other professional groups that would fall under this and who have a dog in this hunt. And so we have a pretty broad coalition of 40 some odd groups going after this change. The other tax increase that we are going to support is going to be an increase in tobacco taxes, another $1 per pack, as well as to bring vaping products in under the tobacco products tax. Right now, vaping products are taxed, but only at the sales tax rate. And it just seems that since they're utilized and essentially the same, that they ought to be taxed at the same rate as we tax tobacco products. Next slide, please. And First Tuesdays. We have instituted, thank you, Pam Udall, the First Tuesday in the District program, and thank you, County Medical Society folks and Alliance members and doctors who participated. This has turned out to be a superb way of getting local doctors and members of the legislature together on Zoom calls. And frankly, the legislators like it. They're starved for these kinds of interactions, and it's been extraordinarily helpful and useful. And so we've done a number of these. We will do many more. I'm looking for us to continue to do these during the session so that the members who are here and who are somewhat socially distanced from all of us will still have the opportunity to catch up with local physicians and on medical issues. It has been a real success. I will say that going forward into the session, do not expect us to have First Tuesday programs as we've had in the past. In this day and age, without the ability to gather you all safely, we are not going to ask 200 physicians and members of the Alliance to come to town physically for First Tuesday. Number one, very bad optics to gather you all in a place. We certainly don't want to be responsible for a super spreader event. Number two, even though the Capitol building itself will be open, I'm not certain how many offices are going to be open and on what basis we're actually going to be able to safely engage them in person. And So we are going to convert First Tuesday in 2021 into a virtual legislative briefing. And rather than doing a 7 a.m. legislative briefing with the lobby team, we'll do a noonish type of briefing with the lobby team, but involve as many thousands of doctors who want to join us across the state for that briefing. One will give you the lay of the land as we currently see it. Two, the issues that are hot at the moment. And three, here's what we need for you to do. And that's generally what First Tuesday has always been. And that is what First Tuesday will be in a virtual environment as well. Next slide, please. TEXPAC, we've now concluded the elections. We had a strong showing in the elections. And I'm getting overwhelmingly the candidates we supported won. Still mourning the loss of Sarah Davis from Houston. She's been such a great friend to TMA and to physicians during her time in the legislature, but nevertheless, and it is now time to continue to join TEXPAC and to continue, because our coffers, the cupboard is bare, and it's time to replenish it, because you know what, the 2022 elections have already started. Next slide, please. No, I didn't realize I'm at the end. I'm done. I will do two things. Number one, if you have any questions, certainly happy to see if we can't answer them or evade them skillfully. And I'm pleased. I see that Christine Mojizadi, our PAC director, has joined us, and Michelle Romero is here. And if I can't answer it, I know they can. So happy to open it up to all of you. Thank you, Martha.
Martha,
Thank you.
you're on mute. Yep.
I appreciate you being on. Great information. Anybody have any questions? We can either use the chat feature, or you can just unmute yourself and ask a question.
I will say, while you all are formulating that, I'll ask Michelle Romero if I missed anything of critical importance that she wants to pass along as it relates to Medicaid coverage expansion of the budget.
Well, Dan, I think you did an excellent job.
I was fishing for that. Thanks, Michelle.
And as Dan mentioned, it's going to be a difficult budget year, but we think that with everything that's happened with COVID, it's really laid bare the lack of access to insurance and the rising number of uninsured. And so we see it as an opportunity to draw down those federal dollars. We really need those dollars. One legislator from San Antonio, a conservative legislator, a Republican legislator, said that, every opportunity we have to draw down federal dollars for transportation, for infrastructure, for public safety, we grab those dollars. And so there is no difference when it comes to healthcare, because it's about the economy, and we need those dollars in our healthcare economy to further our recovery. And as Dan mentioned, when someone loses their job, they're more than likely have lost their insurance. And expanding coverage is not expanding an entitlement, because these people are the working poor, and they're stuck in that gap where they're too rich for Medicaid, but yet even though they're working and they're on the front lines, they can't afford the rising costs of premiums. And so we think we do have some leverage, but it's going to be difficult, and we're going to need your help as much as possible moving forward. And I think TMA has always supported reducing the number of uninsured. We're going in the wrong direction. Last year, by the end of December, we added 230,000 folks to the number of uninsured, and that's pre-pandemic. So we're very hopeful that the legislature will act in some way. And as Dan said, it doesn't have to be an all or nothing. We have the ability to create an innovative program like other states have to address the uninsured. And so, some members will say that it's, going to increase the rolls in Medicaid. Well, no, because this won't be a Medicaid. It'll be Medicaid dollars, because that's the vehicle to bring the dollars down. But it will be something uniquely Texas. I just wanted to add that point. But
Great.
other than that,
God bless us. We're Texas. Texas strong. I see Christine, thank you for posting in the chat what the dues are for the Alliance TexPAC membership. We certainly would encourage all of you to join. And for those of you who already are, we're grateful for your support.
Dan, this is Jerry.
Oh, I thought I was talking to the Alliance.
Yeah,
I
well,
see Keely on here. Now I see you.
yeah,
He is an
no,
Alliance member.
That's true.
you're just not going to see my face because I'm busy stuffing it with fried Yardbird. So
Thanks.
on my lunch, I didn't want you to see that. But I had two questions. One, great presentation, but you didn't bring up marijuana legalization. You know, and
Yeah.
two, is it a sexist thing when I get on these Zoom calls? You, Troy, and Clayton, y'all look pretty casual and scruffy, kind of like I do most of the time. But Michelle, Christine, they always look, Pam, they always look completely put together. Is there something I'm missing here?
No, I think you hit that right on the head. Yeah, I'm wallowing in scruffiness at the moment. I may shave this week. Your question about marijuana is a good one. And remember, every session we deal with about 7,000 pieces of legislation. About a third of them deal with healthcare. Frankly, that will be true. The filing is actually ahead, and there on day one, the two areas that had the largest number of bills filed were Medicaid, just broadly. Now there were 23 bills, and marijuana, which had 12 or 13 bills. And it will range from approving the medical use of marijuana to the full approval of marijuana for recreational use. I'm a little leery of medical marijuana simply because I think it makes you the gatekeeper for recreational use. And nevertheless, it is what it is. And the legislature will likely debate that probably as not so as much for its potential to raise revenue for the state in a very tough budget year as anything else. I expect a number of marijuana bills to be in.
Okay. One other thing with regard to the PAC, I would like everybody to take note and give Christine a pat on the back for jumping on top of the judicial races and coming up with a way for the PAC to issue kind of the slate cards, although it was a slate paper. If you notice, it did make a difference, I think, in that all of the judicial candidates won. And I know it was really tough for the PAC because the only thing I could understand is they must have had real difficulty finding any Democratic candidate who would support tort reform, because normally the PAC works very hard to be very bipartisan, but still they did a great job. And thank you, Christine.
Thank you, Jerry. Appreciate that.
And Jerry, you'll recall back in 1988 and 1990 and 92, in that era, we were thrilled to have Justice Raul Gonzalez, a Democrat, that we could put on a bipartisan slate card for the Texas Supreme Court. It seems no longer do we have that luxury or ability.
Well, hopefully, if we do a little more homework, we can come up with a few candidates and sway them that protecting tort reform is not a death knell.
I will tell you that that we will, obviously every session since 2003, we've had to go defend the liability reforms from that era, and we have. And 2021 will be no different. In fact, we've already seen a bill introduced for the third session in a row to raise the cap on non-economic damages and index it to inflation. And it comes as no surprise, but yet again, it comes. On other liability issues, we're part of a broader coalition with the Texas Civil Justice League and the Texas Alliance for Patient Access, drawing up a bill to provide broadly for liability protections in this COVID pandemic, basically raising the threshold to a gross negligence level. And then a second bill that would, for future pandemics, basically trigger an increased protections for liability for healthcare for physicians, hospitals, healthcare workers, and general business liability as well. So that issue will be fairly prominent, and we will be part of a broad coalition supporting that in the coming legislative session.
Well, again, thank y'all. It was a great update.
Thank you. They still got 10 minutes before anybody can get CME credit.
Dan, this is Elsie Whitmire. I'm
Yes,
president
ma'am.
of Harris County in Houston.
Oh, congratulations.
Thank you. I have one question. Of course, my medical interaction my husband was in practice for 40 years. My daughter is a medical doctor. My granddaughter is a medical doctor. So my question is the taxation by insurance companies. Now, if these were celebrities and athletes, professional athletes making millions of dollars, I could understand taxation. But please explain what would that look like? Thank you.
Oh, I don't really know. The taxing on medical billing that I talked about earlier is really a very specific application of a sales tax to a service that physician practices may engage in. And the larger the practice, the more likely that is to be performed in-house. The smaller the practice, and the medium-sized practices go out and engage generally a small business to do their claim submission and charge a fee for that. And if that fee is subjected to sales tax, it's not that the insurance companies, the doctors can't pass that off either to the patient or the insurance company, because that's basic. They're working on a contracted rate, and so the inability to pass, like any other business that would be able to pass a fee or a tax ultimately to the consumer of their service, it is non-existent in the practice of medicine, and that's why it's so unfair. We don't tax. There's two things in the state that we don't tax. We don't tax a can of beans that you buy down at HEB. We don't tax medical care, and this begins to crack that prohibition on taxing medical care if they're going to require physicians to actually pay a sales tax on a billing for billing service. So that's the issue there. We will continue to make sure that there is a broad prohibition on applying taxation to medical care in the state.
Wonderful. And one other quick question. When exactly was your birthday? I had a birthday recently.
November the 16th.
Oh, no, mine was in
Monday.
Oh, Monday. No, mine was in September. It's just that I'm still celebrating. Okay.
Good for you. And I'm not celebrating so much as I'm just going, meh, it's another day. I've had so many of them. Okay. I'm beginning to think like, I don't know if you recall the famous words of Mickey Mantle. And he said, if I knew I was going to be around so long, I would have taken better care of myself.
Oh, wow. Perfect. Thank you.
Well, we had a question about CME. How do I get it? One more time. All you have to do is answer a question of what did you learn, or what action will you take from what you learned. If you'll put that in the chat, that will get you the CME credit. Well, thank you, Dan, and everybody for this great presentation. We look forward to the virtual First Tuesdays. I hope everybody will participate and get all of your colleagues and your friends to join with us, because it's going to be a great opportunity since we are online. I see that Dr. Sue Bailey is with us today. She's the current AMA president, and I just would like to say thank you for joining us today. We appreciate you being on this call, and we appreciate everybody being on the call. Thank you for your time. I just have a few announcements. They say that laughter is the best medicine, and I think we could all use some laughter in our lives. I am inviting you for some comic relief. I found a comedian, Jean Robertson. She is a great, fun, clean comedian. I tried to get her to come for an enrichment series, but they don't do Zoom. So she sent us the next big thing, which is a live stream of her next event on December 3rd in Charleston, South Carolina. If you want to do it, it will be a $25 charge, but it should be a fun night. And you can go to her website, and that's just jeanrobertson.com, and you can sign up there. There will not be an Enrichment series in December. However, we do have all the webinars posted on our website at TMA, TextMedAlliance.org. I'm sorry, www.textmedalliance.org. And you can always go back and hear the replays of anything you might have missed. Also to remember for the Alliance members to go to our website. It's a place you can go for everything you need to run your county alliances. There's membership messaging on there, how to join, how to renew your membership, community event ideas, and a lot more. So again, that's textmedalliance.org. And I'd like to thank all of you who have renewed your membership for this time of year. It takes all of us together to support the family of medicine. Being an Alliance member is like no other. We truly understand what it means to have a medical marriage. And if you've not renewed your membership, please take the time to do so today. You can go to the website, textmedalliance.org, or you can call the TMA Knowledge Center. And I'm going to give you the number. It's 800-880-7955, and they'll be glad to help you out. If you have any questions or if you any for the 2021 Enrichment series, any ideas for topics or speakers, please let Pam or Sasha know, because we're going to continue this series all the way through next year. And it's also time for the TMAF holiday sharing card. You will be receiving that shortly in emails. All donations from Alliance members will go for the Alliance projects, such as Hard Hats for Little Heads, Be Wise Immunize, and the Bookshare program. All donations are greatly appreciated, and so please be on the lookout for that. Any other questions or comments?
I have a question.
Okay, Lisa.
So that was really exciting to hear about legislation that we can all relate to. And I really appreciated you going through the different legislation and the different topics. And Michelle mentioned that we have a lot of work to do. Can you just, for any of the TMA people, just walk me through, as I'm a member and it's legislation time, and I'm really fired up about legislation having to do with budgeting for GME, because I remember being a poor in that phase of our lives, and it was really hard.
Mm-hmm.
So what is the easy way for me to figure out what to do? Where can I quickly figure out, is there a bill that relates to this? Is there a message that like pre-written approved message that I can just quickly email my representatives? Like what are my easy next steps to do to go forward?
Thanks. What a great question. Thanks. Number one, find out who your state representative and state senator are. If you don't know them, if you don't know who they are, find out who they are. Let us know, and we'll make sure you get an email address for them. Number two, I would consider writing your concerns and your support for GME funding in a message to them, and offer to visit with them at an early opportunity. Three, reach out to your county medical society, because we may be organizing the first Tuesday in the district event in your area. If not, we'll be happy to organize a first Tuesday in the district event to have a Zoom call with your state rep and or your state senator. We'll do them at different times. I forget what number I'm on. I think I was 3. Number 4, we are putting together a series of one-pagers on the variety of issues that we're going to face, and certainly GME is one of them. And so as soon as those are done and posted, we'll make sure that you all have links to those one-page fact sheets that basically give you the background of the issue, where TMA is on it, and what our legislative ask is. And so be on the lookout for those. They should be online very shortly. Does that help you out? Michelle,
Yes.
do you want to?
Yeah, sorry, I just couldn't unmute. Yep, thank you.
Yep, you're welcome. Michelle, do you want anything to add? Because that's an issue you deal with intimately.
Right. Elisa, yes, graduate medical education has gotten such strong support from the legislature. But as Dan mentioned, we do have a budget shortfall. And so that's always on the table of potential, I wouldn't say exactly a cut, but they may not fund it to the level that we need to have graduate medical education funded in order to keep expanding and growing our residency slots. But stay tuned, because we may, with the new speaker, at least on the House side, we may have a new chair of the Article 3 subcommittee. And that's why I talk about Article 3. That deals with medical education. So we're going to have a new appropriations chair. We're going to have a new chair of the subcommittee that deals with graduate medical education. We may even have a new higher education chair on the House side. On the Senate side, we do have some really strong support from those members, but we will have some additional names for you, but definitely start off with identifying who your state rep and senators are. And you can find there on our website. We have a tool where you can locate those. Yeah, and so and you'll be hearing more updates in our Texas Medicine Today. We're going to be updating the key bills, and so you will be hearing a lot about graduate medical education.
And we'll be providing resources too in the TMA Alliance monthly memo and also in the county leadership email updates. We'll make sure we provide those resources to everybody and make sure you know where to find information that we're working on for the session.
And Pam, real quick, can I add something about
Yes.
Lisa's question about contacting your legislators? So we have a program called Voter Voice, which is actually used especially for communicating to your legislators. So let's say there's an issue like Michelle's talking about GME funding. It will have a pre-populated message email for you. All you have to do is and you just press send, and it gets sent to your legislator as well as any legislator you want. So that's something to look forward to during the legislative session. Jennifer Perkins, who's on our communication team, heads up that endeavor. And I know at Advocacy Retreat, she will be doing a presentation on that. So please just let any of the lobby team know. We'll get you set up with Jennifer to get signed up for Voter Voice. But it's a really easy tool. It's just a one-step on your phone or on your computer. And that way, you know, you can go about your daily lives. All of us have busy things to do, but you know, you can just press send and your message gets sent across to the entire Capitol.
Okay, thank you for that. Any other questions or comments? I believe it was addressed in the chat, but Pam said that they would send all the names of the participants to the CME so that you will get credit for this. I would like to say thank you again for everybody participating today for this Enrichment series. We want to say thank you, and if you, we just wish all of you a safe and happy Thanksgiving. Everybody stay safe, and we look forward to seeing you another next time. I know that the Advocacy Retreat is December 5th. Is that correct, Christine? So please make sure you sign up for that. There will be a lot more information from there as well. So that you can sign up at TextPack, right?
Just go to the texmed.org website and there should be a link for conference registration.
Okay, perfect. So everybody please sign up for that. That it will be a fun conference. Even though we'll be Zooming, it will still be a fun conference. Anything else, Pam?
I think we've covered everything. Thank you, everybody, for joining us today. And we look forward to seeing you in January for our next enrichment series. In the meantime, check out the ones we have on the website. And have a
actually,
wonderful
just
Thanksgiving.
quickly to say, the alias for the Advocacy Retreat is texmed.org/advocacy retreat. I'll get you right there.
Perfect. Thank you.
Okay.
Okay. Thank you,
Bye,
everybody.
everybody.
Bye, y'all. Thanks.
Bye-bye.
Thank you, Dan.